Internationally, it is accepted that when somebody has got HIV, AIDS, it's a chronic, manageable disease, like diabetes. And if you manage it well, people can live to the ripe old age of 100 if that is in their genes. They do not need to die as a result of HIV/AIDS.
This is largely due to antiretrovirals, medicine which prevent the HIV virus from growing inside your body. However, only a tiny minority of South Africans can afford these drugs, which can cost up to 4,000 Rand a month.
I'd known for many years that I had HIV. And I think that every person with a life-threatening condition hopes that that condition will never materialize. Everyone hopes that the day will never arrive when you have to admit, I'm now sick. And I ignored all the signs. I fell ill eventually in October 1997, but for about 15 months before that, my strength was going.
She says, oh, you've got these lymph nodes. It might be anything from any bacteria, it might be something from a virus, or it might be HIV. And I said, well, I'm probably HIV negative. I tested a while ago when I got raped, and I tested 3 months. And then I remembered I was supposed to go back 3 months later, but I just didn't go back. She said, oh, well, do you want to do an HIV test just for completion anyway? And I said, yes. And in the end, they only did the HIV test because the other two were really expensive. And then they called me, and this, on the 23rd of April, I found out they told me that I was positive.
In October 1997, I had to admit that both my lungs were completely full of PCP, which is the pneumocystis carinii pneumonia, which affects people with AIDS. And I had esophageal thrush. I'd lost a lot of weight. I'd lost 10 kilograms. And my blood count showed that my immune system was failing. My blood count had gone below 200. So I had 4 of the classic symptoms of AIDS.
It disrupted school a lot because at that stage, I'd had the stage when I found out that I had the senior flu twice. And I just had so much work piled up, and then finding out just drove me a little bit crazy. And so I ended up deregistering from school and just taking a holiday to think about it. And I had trouble telling how I was going to tell my mom about my HIV status. But that was the worst of it. After I told my mom, I felt so much better.
I used to hear people and say, if you're HIV positive, you're going to die, you know. So in my mind, I was having that attitude, you know. But after some few days, I tell myself, no. There's the only person who knows God, you know. There's no one can judge me when I'm going to die, you know.
I went to my doctor, and through him and through X-rays, we confirmed that this was the position. And I then had to decide what to do. I had tried to avoid antiviral treatment. I knew that there were very severe side effects. I knew that they were difficult to take, they were complex to take. And also I knew that there was a risk of treatment failure. The drugs don't work for everyone. So I was very fearful. It was a difficult time. I was in denial to have to face the fact, not just that you have HIV, but that you have AIDS, and that if the treatment doesn't work, you could be dead within 2 or 3 years, is a very momentous thing in one's life, and it's very difficult to face up to. But I had very good medical care, a doctor who was alert and very competent, and we treated the symptoms first. And there again, I felt very blessed and very privileged because I had the best treatment available. And then when I started getting better after 3 or 4 weeks, we had to make a decision about antiviral medication. Now here again, I was very privileged because I'm in the very tiny, tiny minority, the minuscule minority of South Africans who can actually afford these medications. I can't afford them easily, but at least my medical aid is paying half of them, and I can afford to pay the other half. So I was able to start on antiviral medication.
Some positive people who are not able to afford medicine enter drug trials to get access to antiretrovirals.
They did all sorts of tests, and then I had to go back to see if I qualified, and I did, and then I started going on the trials. I've been on them now for about 4 weeks, and I don't know yet really how I'm doing, except that the side effects are killing me.
But being on antiretrovirals is not always plain sailing.
The side effects that have affected me are nausea. The nausea is really bad. It's like basically 24 hours whenever I'm awake, the nausea is there. And it's been also like sleepiness. They make me very sleepy, and they make me really tired. Sometimes I wake up in the morning after 8 hours of sleep, and I take a bath and I eat. and I prepared for my day at varsity. And by the time I finished my first lecture, which is like 3 hours after I got up, I'm tired and I want to sleep again.
The protease inhibitors, these eventually reduced. The perioral neuralgia around my face reduced after about 2 months, and the nausea reduced after about 7 months. But for the first year and a half that I was on the protease inhibitor, my tummy was never right. My tummy was very severely reactive to these drugs, and I had to be sure that for 2 or 3 hours after I'd taken the drugs that I was close to a toilet.
Because of the side effects, many patients skip their medicine or stop taking it altogether.
The reason why we counsel patients extensively before we put them on retroviral therapy is that they have to take the medication correctly, at the correct dosage and at the correct times. If they skip medication, there will not be enough medication in the bloodstream to suppress the virus. The virus will grow and become resistant to the medicines. That state of affairs leads to a situation where you have no benefit for the patient because the virus is still growing, but it is an expensive exercise because we're using drugs that are now not working. And of course there's always a possibility of spreading antiretroviral resistant virus. So the next person who gets it now already can't use the medication that the previous patient was on.